This portion is brought to you by Mercury Drug, nakasisiguro gamot ay laging bago.
Today on Generation RX Plus. Christmas Day may have passed, but the celebration has just begun. It will be the New Year soon, so prepare and know what to expect when you inhale smoke from firecracker explosions in our Ask the Experts. Once again, your cooking lessons for the holidays continue as Chef DJ and May prepare a dish that's tailor-made for your medianoche in this cooking show from Technogas on our La Mesa Jam. All these and more on Generation RX Plus.
It has been a tradition among us Filipinos to welcome the new year with firecrackers. Number one, because firecrackers are not very expensive and they say it's a way to ward off the bad luck of the previous year. But what we keep ignoring are the diseases that come about with smoke inhalation from a firecracker explosion. Stay tuned to find out more. Good morning, this is your host, Dr. Cecil Katapang, and you are watching Generation RX Plus.
A good respiratory system is what we call good air entry and a good carbon dioxide exit. The transport of gases is very important because this will sustain hemodynamic stability in the whole system. Pag maganda ang respiratory mechanics natin, syempre maganda rin yung oxygen delivery to the tissues. When we say delivery to the tissues, from the skin outside, sa brain, sa heart, and the all body parts. With the new researches now, metallic particles in the smoke that is being released or emitted from the fireworks itself or firecrackers pose a health risk, particularly among individuals who suffer from bronchial asthma. So let's include those with structural lung diseases like chronic obstructive pulmonary disease. I'm sure you know about COPD, and also those with cardiovascular problems. You see, when pyrotechnic display takes effect or takes place, so what happens there? It releases a lot of smoke, liberating several poisonous materials that have direct effect on the lungs. Yung respiratory system natin ang affected. Primarily, pwedeng magkaroon ng cough yung pasyente na yan. Usually prolonged, walang patid na pag-ubo. Pwede rin magkaroon ng hoarseness or yung noisy breathing. The explanation for this is nagkakaroon ng fluidation dun sa upper airway. So nagkakaroon ng block, sometimes nagkakaroon din ng spasms. No? Putting on mask definitely would help you. It will help in terms of decreasing the probability na maka-inhale ka ng toxic substances. If they develop hoarseness, incessant coughing, shortness of breath, and even mental confusion, they should seek medical consult. So they go to the emergency room and they be evaluated. Pagka ganito hong dumarating yung bagong taon, hindi naman ho talaga natin naiiwasan yung pagpapaputok, even panonood ng mga fireworks. Okay lang ho na magsuot tayo ng mask, pero ang pinaka-best remedy po dyan is to stay away from the place kung saan meron pong pyrotechnic display. Iwasan lang po natin yung makasinghot tayo ng mga metallic components na talagang totally hazardous sa atin. Eventually, in long term, dun lang natin mararamdaman yung mga toxic effects na mga nai-inhale natin na ito. Whether yung metallic particles or even yung mga ibang gaseous substances.
So now you know the dangers of inhaling smoke from a firecracker explosion. The Generation RX Plus team would like to thank Plantation Bay Resort and Spa. I would like to thank Metatayon for my whitening care, Color Collection Cosmetics by Tupperware brand for my makeup, Make Me Blush for my hair and nail care, Walunggay Life Oil for giving me the pure power of Mother Nature, and Look Young, Move Young, and Feel Young with High C from Pine Japan. The Generation RX Plus team would like to wish everyone a healthy and prosperous 2015.